This one topic here is revenue cycle firm opens new Ohio office. They process revenue cycle activity for 200 hospitals. They have 500 employees. And so you have third parties handling the financial revenue issues of hospitals. Why does this problem even exist? Why can't hospitals take care of this themselves?
It starts with the structure of the insurance. I mean, it's a game that's structured against the receiver from the get-go. And the structure of the contracts are such that any mortal human on the back end of the process has no clue deciphering it unless they've got some help systematically. And that's why software exists, like follow-up system. It's like why companies exist, like this one in Ohio. It's either the complete outsourcing of the process or consulting work, or hiring a company like ourselves, software companies, to come in and provide solutions that the Epics and Cerners and the big IT systems don't provide, because they're so wrapped up in providing the day-to-day of the hospital.
Are there any steps that a hospital administrator can take that would allow them not to have these third-party entities helping them out?
You know, what can a hospital administrator do is one is have the systems in the back end to report the data into the operations of the hospital, so that if you're getting denied for a pre-auth code, you know how to go fix that. If you're getting denied for medical records, you know, you can have your medical records department do what they need to do to fix that and make the records more accessible. You know, you may have a broken or dysfunctional pre-authorization process in your facility. It would be hard enough if it were just a standard business procedure. You know, the inventory of just a regular billing process of all the things, just getting the stuff on the bill is hard enough, and getting it out the door. To have it complicated by all the denials and the silly things that insurance companies do. And unless you have a system in place, you're never gonna have the ability to look at the data in any way that's going to give you any pattern, you know? And if you don't know that the denial rate of Aetna is 5 times what it is and 5 times longer than your Blue Cross on the same thing, you know, you're just going to be left to your own people to find those. You know, if you have software that bubbles it up for you and that's canned, and that you have your dashboards to say, look, you just got billed this $1 million, and here's what that $1 million looks in the next 4 months. Where is it going to come in? Is it going to only come in half? You're only going to get 500,000 of it? Are you going to get 500,000 in the first month and then trail off? So, I mean, for your financial picture, for your CFO meetings and for all that, having systems in place on the back end of this process is absolutely crucial.
You mentioned having dashboards on your software that would say, hey, insurance company 1 pays this type of claim with this type of balance in X amount of time, but insurance company number 2 pays it in 5X amount of time. This insurance company is doing a great job in comparison to this company. Now that I know that, what can I do?
Right. Well, it allows you, we went to the Texas Rural Health Conference last year, and there was a talk about specifically the pool of data that ends up at the bottom of this process. It's the denial rates, it's the denial reasons, it's the number of times they're being denied, and it's the pay rates. And what that is ammunition. And the reason that you need to gather this data is because when you go to negotiate your next round of contracts with your payers, you're going to have ammunition to be able to go, hey, Blue Cross, you know, you're paying these hip replacements at 80% in 20 days. Humana, you're paying me at 60% and you're paying me in 90 days and you're denying it 6 times. Why is that?
Okay.
And what can we do? It holds the feet to the fire. It gives you the ammunition to go into the battle of contract negotiations with some knowledge, with some recon, because I can tell you the insurance companies have it. And not many business office managers have the wherewithal, the company support, the IT support to gather this pool of data like the insurance companies can. And so the value of having systems like the follow-up system or any system is that you're gathering this basically armory of ammunition to go fight the battle of contract negotiation.
They ask, what's the biggest challenge you're facing as a revenue cycle leader? And it's just like Chuck was saying, increasing denials from payers and denials that are coming in non-traditionally. There's a traditional denial where they say no payment, but then there's what they call the silent denials, which are DRG, diagnosis related group downgrades, or account audits that happen. And Florida law, apparently managed care plans have 30 months to come back and review payments. So they use that time period to conduct audits on medical necessity and level of care and review payments and do takebacks. It's a game they're playing, right? And it becomes very challenging to track these takebacks from all the payers.
It's a hardcore game. And the thing is, you were talking about the untraditional denials. I mean, the denial codes come in, there's the 835. I mean, the data's there. It's in your electronic billing. And if you can get it out and pool all of the traditional denials in buckets to say, here's where they are and here's what they're doing, here's how many times they've been denied, and here's the gap between those denials, you can actually calculate how many times you have to touch these claims. It's like I got to touch Aetna claims 30 times before they're paid, and Blue Cross, I got to touch them twice. That's huge. That's large. When I'm sitting there and I've got 5-10 people trying to work on this, or like the company in Ohio, 500, multiply that. How much of a time waste is that? The bad thing that happens is that the hospitals just write it off. It's in just huge buckets of money that they're just never going to go after. It's like having a gift card that you never spend. It's just free cash, So if I can get you, just beat you down and get you to write off $5 million, good for me. That is what one of the specialties of the follow-up system is that low end, low balance, high volume thing, because it became, and unless you're a 500 person company, you don't see that scale. And to be able to provide that level of reconnaissance to a full book of work is something that, like I was saying, a mere mortal human can't do. You don't have your fingers on enough data to create it. So, I mean, to have systems in place and the dashboards bubble up where your issues are is absolutely essential, because I can tell you the insurance companies have actuaries and systems that are beating you to death, and you're running the AR of 1/6 of the American economy.
Kyle, in that exact same article, the question was posed, because what advice to other hospital revenue cycle leaders might you have? 2 main comments. You need to dig into your data to understand your current status. Software is needed for that. 2, continuously work on automation and improving workflows so it's continuous performance improvement. Software answers that.
Yes, sir. So I mean, and nobody playing it on the hospital side is anywhere near equipped to play it the way the insurance companies play it.
They're not savvy enough. They don't have the intel, and they don't have the rapid response.
Yeah, I mean, that was just about to come out of my mouth. The rapid response system was developed in response to the low balance conundrum.
Right.
It was meant to take a book of work that had been written off entirely. They were never, ever going to touch this book of work again. because they physically couldn't do it. They're like, we lose money touching this stuff. So 5 million, 10 million, $15 million a year written off. Just a gift, just handed to insurance companies. And we created a process to go through and triage all that stuff with low cost employees, FTEs, and canned it, you know, to where that recon and that knowledge don't have to go search it out. It gets handed to you.
Yep.
So, I mean, you've got to have those systems in place or you're just lost, man. I mean, it's too big to handle on spreadsheets and stuff like that.